have you heard the butterfly effect? This might help you understand what I mean. The butterfly effect is a metaphor that describes very well how natural systemic reality truly works. It was offered by a mathematician and meteorologist. His name was Edward Norton Lawrence. And he said, maybe you have heard about it because it is very widely known and it refers to the theory of chaos. Anyways, he said that the flap of a butterfly's wing in one corner of the world can produce a tornado elsewhere.
Yeah.
So maybe a butterfly flaps his wing in Brazil, and after a few weeks, you will have a tornado in China.
Yeah.
And this impact is not a linear. It is a complex impact that relies on the dynamic complexities that are impossible to be predicted. They rely on the continuity of nature, and just because we have a very limited capacity to grasp natural reality, we're not gods to be everywhere everywhere and at every time. Let's say it's very hard linearly to predict how the here and now will impact the greater systems in the future.
Yeah.
And
but
that's why we cannot predict sustainability based on behaviors and practices taken in limited contexts, in organizations, for example, even on country levels. You cannot predict sustainability linearly.
Yeah,
or development.
But in healthcare, we care about local events.
So you might wonder why.
Do you hear me?
I don't know. Can you hear me?
Yeah, we lost a little bit. But
Maria?
I was saying, yes,
Hello?
Yes. Okay. We missed connection. Yep. Yeah. Let's see. We'll come back again. And λίγο την υπομονή σας να ξαναμπεί. Πρόβλημα σύνδεσης. Δεν είμαστε οι μόνοι που το έχουμε. We have the problems of connection. Let's see. Yeah, can you hear us?
Yes, I can hear you now.
Okay. So,
yeah.
We have said that at the last moment that we in healthcare we are addressing local events. We don't have this sort of issues about the butterfly effect, that you said before. How do you think this connects with what we are facing in healthcare?
Yes, you might think that as a healthcare professionals, you should care only about local results. Maybe this is so. Maybe you are interested to only bring local results. Yet your behaviors and actions in ER rooms or in surgery rooms, either we like it or not, do not stay there. They can and actually do have an impact on other departments, on the whole hospital, let's say, on the healthcare organization, on society. And you cannot isolate the impact that a behavior or an event that takes place in a specific place, for example, as I said, in ER room or in surgery room, you cannot be sure that you cannot isolate it so that it will impact only the systems within this very limited context. It has an impact on a wider context, and we are very interested to know how we can control this impact, because as healthcare professionals, I suppose that you are interested to promote not only individual health, but the health of the populations, and the health of the populations is the health of a wider system, which is affected by the behaviors and actions that you take in very limited contexts. In the hospital or in a specific department, or in a specific
in a dental office, or whatever the healthcare sector is.
The butterfly effect isn't an issue that pertains only to sustainability. It is an issue that pertains in everything, in performance, in healthcare quality, and big time. So if we are interested to predict results, we need to be aware of this. And I know this might be very uncomfortable, because we want to be able to know that we can predict things, and that we can control things, and we can control results. But if we don't face this truth, and if we don't try to address it, it will not go away. It will be there, and we will not be able to do anything about it. So we need to address this truth, to look at it straight in the eye, to accept the insufficiency of linear thinking to predict results, and to turn to other approaches in order to take control of the butterfly effect.
Yeah. Okay, I understand. I suppose also our colleagues have understand that our little self, our behavior has an impact overall. But let's go back to the pleasure thing that we were discussing. And you could say that it is a bad thing, and we need to control it.
Yes, we need to control it, but it is not a bad thing, not at all. Quite the opposite, I would say, because our pleasure-seeking dispositions might hamper performance, but might also promote it. So pleasure shall not be demonized. There is a very good reason why we experience pleasure. And pleasure defines motivation. It is vital in survival. Those in the field of neurobiology, neuroscience, and psychology, of course, are fully aware of pleasure's impact, positive impact on performance. It stimulates personal growth. It can help us induce very healthy behavioral changes. It is very helpful in stress management. And actually, studies today indicate that the stimulation of brain's reward circuitry can have a very important impact on the physiology. And they say physiological reactions, and the placebo response, you're very familiar
we know that.
with, is a characteristic example of how pleasure can impact the human system.
But in this sense, we only have benefits then, or we also have risks?
This is the trap, that it has not only benefits, it comes with a risk. So if it remains unmanageable, if this our pleasure-seeking, let's say, tendency remains unmanageable, then performance is only randomly efficient and randomly sustainable.
And what do you mean randomly?
If we don't manage our pleasure-seeking dispositions, let's say, then will be driven by our pleasures. At any point in time, we will do what is pleasant to us to do, and not what is needed in order to bring sustainable results, the optimal healthcare quality performance. So it's very important to be fully aware of our natural dispositions towards that are driven basically by this fundamental pleasure-seeking tendency, and to control them, so that to be able to take full control of our performance that has huge impact on sustainability and business results or healthcare quality.
Exactly.
Yeah,
Exactly.
depending on the contextual goals in every particular framework.
Mm-hmm. Mm-hmm. Okay. Okay. And it would be really good to discuss about some more examples of how these pleasure driven dispositions, affect our performance as healthcare professionals. Can you give us some more examples?
Pleasure can affect any aspect of performance you can think of, and in many different ways. For example, it affects healthcare professionals' interactions and relationships with colleagues and patients. And people tend to communicate and collaborate with a person they like and is
Yeah.
pleasant to them than a person they dislike and for whatever reason is unpleasant to them. They might even avoid people that dislike and are pleasant to them. They don't feel comfortable around them. They feel more stressed.
Mm-hmm.
No,
Yeah. Yeah. Imagine if this is your supervisor or someone who is higher than you in the order of the organization. That could be quite tricky. Yes.
not necessarily, because it might be a superior and inferior as well, person on a lower ranking, but that for whatever reason is unpleasant to you, that brings you in a very uncomfortable position to handle him or her if you have these strong feelings. For example, your attention might be distracted if you feel uncomfortable next to someone that stresses you because it makes you feel in any way unpleasantly. And the same things happen if you like someone too much. For example, if you have a sexual attraction towards a colleague or a patient,
Yeah,
sometimes
that is true.
happens. And if you are in love with someone, this also is very difficult to handle. And
Mm,
teamwork might be affected for the same reasons. And
of
teamwork
course.
today is
Yeah.
considered as one of the most important leadership skills in healthcare
Mm-hmm.
environment.
Mm-hmm.
So this parameter of pleasure is very, very powerful and very important to manage it in order to control performance and results.
Mm-hmm. Yeah, but we said here that pleasure defines whether and how policies and the code of conduct are applied, as you mentioned before. What do you say more on this?
Listen, violations of policies, of protocols, and code of conduct, of course, are deeply rooted in people's natural drive towards pleasure, because any deviation, either it is medical, from any standard, either these standards are medical or moral or professional, you name it, any deviation is deeply rooted in the natural drive towards pleasure.
Mm-hmm.
And deviations take place because people have the tendency what is convenient to them to do, what is pleasant to do, rather than what is right. And it is a human thing. It is a
Yeah.
human thing, and we need to embrace it because it characterizes all of us.
Mm-hmm.
Um, so, what is commonly known as a comfort zone as well, that we all know that comfort zone is something that hampers development and competes optimal performance, is basically a zone of pleasure.
Yeah.
Uh,
Is where we feel safe. Yeah. Okay. I understand. I understand your
Not
point.
only
Yeah.
safe, but also comfortable. Comfortable means that I feel at ease.
Mm-hmm.
And it is a pleasant feeling. It is not pleasure as an experience, but it is a pleasant feeling. And we do what is comfortable because to be comfortable is a pleasurable experience. It's not a pleasurable feeling, a pleasant feeling. It's not unpleasant. It is
Mm-hmm.
unpleasant to go to transcend comfort zone. This is unpleasant But we
Yeah.
have to sometimes, we have to do it, if we are to develop. And we have to be aware of our tendency to be where it is comfortable to us, and
Yeah.
then to make a very deliberate decision to get out of this comfort zone and do something that might be initially unpleasant to us, but it is the right thing to do for us and for others. And
Yeah.
so we do it. And so we do it. But if we rely only on our disposition to do what is pleasant for us, we will never transcend our comfort zone. We will stay there forever. And we will be absolutely pleasure driven, like animals that don't have consciousness. I mean, they have consciousness. They don't have a rational and abstract thinking that humans have. And it is very helpful in the management of
Yeah.
this pleasure seeking tendency.
You mean that we are going to stay stable, okay, not grow, not to go into the next level of our evolvement, let's say? Yeah, is that so?
Exactly. Yes.
Okay, okay. But then do you think that if we carry on with this zone of pleasure, we could also affect somehow other skills like our medical skills, our clinical skills?
Uh, Pleasure affects other skills. Yes, this pleasure seeking tendency, let's say, affects other skills. When we go, when we transcend this comfort zone, we need to develop some skills, which is not very pleasurable in the beginning, but then it is very useful. And in the process, it becomes less stressful and less unpleasant. But in the beginning, while we try to transcend, to get out of our comfort zone, this is not a very pleasant process. But since you refer to the skills and how pleasure possibly affect them, I mentioned some examples before, but I have to now that it also affects hardcore medical skills.
How's that?
As I said, it affects attention. It distracts attention, and medical errors might be triggered by the pleasure-seeking and pain avoidance drive. And also, studies have shown that pleasure can affect performance in high technical skills in healthcare, such as medical procedures in the surgery room. Uh, all this happens because the pleasure, the tendency, this tendency towards pleasure interferes, distracts us, and interferes with the application of knowledge and skills. And this is how it hampers effectiveness and efficiency. That's why I said it's about time to pleasure to be included in a leadership program. And I'm confident that in the future, more and more leadership programs will incorporate in their curriculum. But for now, it is an innovation that our program first introduces, because it is our program that first introduces pleasure as a manageable parameter of sustainable leadership.
And then how does the management, let's say, let's go a little bit deeper, how the management of pleasure affect sustainability? Because you are putting the two terms together.
Yes. In exactly the same way it affects optimal performance in any context. Listen, our pleasure-seeking and pain-avoiding dispositions can prevent us from meeting the standards of sustainability, exactly as they prevent us from meeting the standards of performance in any context. It is the same exact process. The problem so far has been that there were not standards of sustainability that could be applied on an individual level, let's say, or on an organizational level. I'm talking about comprehensive standards of sustainability. And so there was not any way to control pleasure meaningfully, so that to align to this performance of sustainability standards. Yet the approach we propose actually coordinates the pleasure standards, the sustainability and performance standards, because it is a comprehensive approach. And that's why it is able to be applied in every context. And as it applies in healthcare environment, it applies in every other environment.
Yeah, but our environment is, of course, more tricky, more demanding. Okay, and that's why we try first to test it.
Yeah. Not only that, I think that you are on the front line. Healthcare is at the front line of sustainability, because your purpose identifies with people's well-being, and people's well-being, as I also said in previous webinars, is the ultimate purpose of sustainable development. If not for people well-being, then for what? Pleasure interferes to attain optimal performance, healthcare quality, if you want, and sustainability, because to know what to do is one thing, even if you knew the criteria, let's say. Most of you don't know them because you haven't attended the program, but even if you knew them, this wouldn't mean that you will be able to apply them, because to know what to do is one thing, but to be willing to do it is another. And pleasure has the power to affect both. This is why it is pivotal to
and so powerful. Yeah, you know, I will like to comment here that we had a lesson in the here in the dental school, and a student asked me, "What is sustainability?" I mean, colleagues may not know the term, so it is really, really important to discuss on those terms, I think, and to connect them, because pleasure we know. Sustainability, maybe we don't know. And so the connection is really important.
We don't, we know what various aspects of sustainability is, but we haven't developed yet a comprehensive definition of sustainability. This program offers a comprehensive definition of sustainability, and this is something that I'm very proud of, because it is the only comprehensive definition of sustainability worldwide. You will grasp what sustainability is. We will not only elucidate some aspects of it, but you will grasp what sustainability is, and you will be amazed of what sustainability is. You will be amazed.
Even in the everyday life, everyday clinical life, professional life, personal life.
It is not a goal of the future that we can attain linearly. Sustainability is a state of being. State. And to understand that, we need to take the pain of some deep thinking. We will do this in the program. As I said, is going to be a mystagogy. This program is a mystagogy. It's not a program that gives you 1, 2, 3 ready steps. Take to bring 1, 2, 3 results. It offers a new way to interpret natural reality, your position in the world, to fully grasp certain notions that are not very clear what they refer to, such as sustainability, leadership, even leadership. Do you know how many definitions of leadership are there?
Oh, yeah, some thousands, hundreds.
Yes, thousands.
Yeah.
There are 60 to 70 theories of sustainability, of leadership, theories. And you can imagine that the definitions are thousands. Every context has a different definition, but leadership is a specific thing, and we need to know what it is if we are to apply it. As simple as, if we don't know what it is, then how are we supposed to apply it?
And also, if we don't understand the need of it, then we don't search for this. Yeah, but let's go back to the manage of pleasure, please, and just comment on how do you think it's possible to manage pleasure? Let's be more practical here.
Okay, there is one way. There is one single way to manage pleasure-seeking dispositions, and this is through the 𝒕𝒅𝒄𝙗. The 𝒕𝒅𝒄𝙗. As discussed in our previous webinars, the 𝒕𝒅𝒄𝙗 leadership model offers the universal and timeless criteria to manage sustainability and optimum performance, but also it offers the universal relativistic criteria to manage pleasure. And virtues can help you do it in a very practical way, very, very practical, everyday way. So we can do it through the virtues, but first we have to understand how all this connect to each other. You have to understand why virtues is the only way to manage the pleasure-seeking dispositions. Because I know that this is a very heavy.
Yeah, it sounds heavy. Yeah, but it's also exciting.
Yes. I take the responsibility for what I'm saying, and in the program, I will explain exactly why this is so. So the CAVE model is the only model worldwide that can enable healthcare professionals to control this disposition. And regardless of the specific nature of this disposition, because every person has different dispositions. We're not all driven towards the same pleasures, let's say.
Yeah, okay.
Regardless of what is the specific nature of your pleasure-seeking dispositions, you will learn how to control them against the sustainability and the healthcare quality criteria to attain sustainable performance and healthcare quality, but also personal well-being at the same time, simultaneously.
Yeah.
And at every place and time context.
Yeah, we have discussed about well-being in the previous webinars, and okay, we are not going to go through that very much. But I would like you to comment also on if there are any other benefits, let's say, for healthcare professionals if we control the pleasure factor.
Yes. Thank you for asking me that, because actually there are other benefits, and it is important to be heard. Pleasure has been recognized as a determinant of behavior long ago, as we said actually in the beginning of this webinar. But recently, medical scholarship stresses that missing to consider pleasure in medical practice has a detrimental impact on all patients. How about that?
Okay.
Why? Because patient satisfaction is a critical metric of healthcare quality today, and undoubtedly has a pleasure coefficient. So, although I need to stress that pleasure is not an end in itself, it is a vital parameter of health. And I've noticed also, because I went through the bibliography in the context of the research I made for the specific program, I've noticed that in the late years, there has been an effort to highlight the importance of pleasure in sexual health, in healthcare.
Okay.
Yet pleasure does not really relate to the sexual health or any other aspect of health or any other behaviors or practices that relate to this aspect. For example, eating habits that affect obesity, let's say.
Yeah. Okay.
A recent study, I think it was a study that was conducted in 2023, last year, so that the pleasure shall be systematically measured and shall be patient's pleasure. And actually, pleasure shall be included in the medical outcomes. and that health-related pleasure of scales shall be used so that shall be used so that to collect data from patients, pleasure-related data, and then to review them in order to facilitate treatment comparisons,
prediction, yeah, of therapy.
For recovery, yes, side effect investigations, and many more practices that can advance, let's say, the medical research and the healthcare practice.
That's quite innovative, actually. Yeah, I don't know if there is.
It's central. It's a central theme today in healthcare research.
Okay. Okay.
Advanced healthcare quality.
Okay, so all these are so important and so really very interesting. I think all these factors and information that you shared with us today, Anastasia, as always, are quite, tricky for the mind, food for thought, as we say. Do you think you have anything else to say that could conclude our today's webinar?
Maybe it would be nice to close with this one. I would like to stress that pleasure serves homeostasis and health. So it is vital for homeostasis and health. And in the program, we will elaborate on this a lot. So maybe in the future, patients' treatment will include patients' education, training upon the issue of pleasure, because the patient is an agent, the most important agent in his or her own treatment.
Yeah.
And since pleasure-seeking dispositions are so important for the person's health because they define the person's habits and even how applies his or her own treatment and how well follows instructions, doctors' instructions, and how well collaborates with doctors in order to promote patient's health, his own health, her own health. I think it is very important that patient becomes also educated on this, on pleasure and how pleasure affects his own health.
Yeah.
So maybe in the future, our program will be central in patients' education. First, healthcare professionals need to be trained. So allow me to invite you all to join the program, explore together the power of pleasure, but also the limitations it poses on health, performance, and sustainability. And I promise you that you will have the opportunity to learn how to take control of this tremendous power you have, the power of pleasure, so that to lead healthcare quality, sustainability, and personal well-being.
Yeah. Okay, so Anastasia, I really thank you for this insight also today. And I hope that that's our scope anyway, that we can create a more resilient and productive and compassionate healthcare environment in the future through our actions, through the actions of others that, believe in these terms of sustainable leadership that we discuss little by little through our free webinars for the moment. So thank you again for the opportunity to discuss with you, and I thank all the colleagues that stayed up until now with us. And so I really look forward to seeing you, to seeing how we can continue to innovate in the field of leadership altogether. Okay, bye everybody.
Thank you, Maria. Thank you all. Bye-bye.